Next, I would like to introduce Nick Wood, Deputy Chief Executive NHS Wales and Chair of the Six Goals Programme Board. Nick will inform us of how we want health boards and partners to work collaboratively with partners to deliver the six goals and how enabling funding and other opportunities will help you to succeed locally, regionally and nationally. Drosodd I ti, Nick. Diolch yn fawr.
Thanks, Glyn. And Glyn is here today to help us through this session, partly as a sort of host really for the day, and also I think to supplement the fact that I have very poor Welsh language skills, so he's been able to dual language our way through the first part of the session. So thank you for the introduction, and thank you for the colleagues who produced the videos that we've just seen. So what I'm going to do really is spend 10 minutes just really talking you through where we've got to with the Six Goals programme, and our intent really as we move into implementation phase from the sort of policy document. And we really are looking today to be the launch for a real acceleration of the Six Goals programme, implementing it locally, regionally and nationally as we move forward. I think in the first sense, really, what I really ought to do is lay out for you the sort of the vision that we have. For many years, and I've worked in Wales for 7 or 8 years now, we've spent a lot of time and a lot of energy on trying to improve what was known as the unscheduled care system, which predominantly focused on ED departments and what was happening within the emergency care system. And this didn't necessarily recognise the huge amounts of activity and patient interface that there was outside of the emergency departments. When we sat down and started to review the unscheduled care programme and move towards the six goals, it was a real recognition that we needed to look at the whole pathway of care for those patients who were presented with either an urgent or an emergency case, and try to deliver that care in the right place first time. Because for so many years we've had so many handoffs and patients presenting in the wrong place. And I just thought, just pause really on this slide, which highlights the six goals, just to give you a few bits of information. Probably most of you know this already, but on any one day in Wales currently, we see around about 2,500 people through our emergency departments and minor injury units. Quite a big number out of a population of around about 3.5 million. We have about 2,500 calls now to our national NHS 111 line. Again, a big number, so very similar number to those that actually attend ED, and gives us a huge opportunity to place those patients in the right place first time. In terms of our current system of ED, if you like, how are we delivering? What does it look like? Well, at any one day, 350 of those patients, so 350 of the 2,500, will spend more than 12 hours in an emergency department, which I think we can all agree is not a satisfactory patient experience and not a way we can really function if we are going to see an improvement in our system. And of those 350 patients, many of them will then spend at least a week, if not longer, within our hospital system, having spent probably a sizable amount of time in an ambulance outside the back door of one of our emergency departments. So the real focus of this programme is for us to shift the dial in emergency care and shift the way in which we deliver the care to the people of Wales in the right way, and trying to do that in a way that delivers locally for them in the right place by the right clinician in a timely manner to meet their needs and meet their expectations. So what we've laid out as part of the six goals are the ways, is in effect that vision of right care, right place, first time, for optimal patient care and patient experience, but also staff experience, so that they are dealing with those cases that they need to deal with in the right place. And we've laid out within the 6 goals, and you've just seen videos from colleagues describing the function of each of the goals, an integrated pathway which starts with prevention and placing patients in the right place before they get their care, through some of our primary care settings, some of our emergency departments or medical assessment units, through to a real emergency via the ambulance into an emergency department. But then really importantly, that their pathway of care through that system is effective and optimal, so that they are discharged appropriately at the right time in the right place. Now, all of that is laid out within the policy handbook, and each of the goals has a lead and a team working on milestones and objectives for each of those 6 goals. And what we would like to see is health boards adopt that in such a way that they replicate the national structure that we've put in place on a local basis, so that we can start to see some real traction in the way in which we improve the service. This all sort of came about when we started to look at the urgent and emergency care system in a much more integrated way, looking at what we could achieve in the longer term if we all put our collective effort behind placing patients in the right place and delivering care at the right time. And in some ways, shifting the focus and the dial away from that focus on a very narrow 999 and emergency care issue, and actually starting to look at the reasons why people attend different parts of the system and what we could do about resolving some of those issues in a different way. So the chart that you see there is a sort of an adaptation of once we looked at all of the different levels of activity that were happening in different parts of the system. And quite often we forget about where people present in the first case for that urgent care or urgent assessment. You know, we know in any one day we can have up to 20,000 interfaces with our primary care teams. Now, if we could improve that so that people are not self-deciding and moving through the system themselves into a different part of the system, then we can start to reduce the activity of our emergency departments, so that only the people who need to attend an emergency department attend an emergency department. And for many, many years, we've talked about admission avoidance and different types of admission, whether that be through local community facilities, through medical assessment units, and now we've obviously introduced the SDEC or ambulatory care units in many of our hospital facilities, so that we move away from patients attending either self-presenting or via an ambulance into a very busy emergency department, spending many hours either on a trolley or on a chair before they are seen and then admitted into a hospital, when we know there are different ways in which we can treat and manage these patients. Once they're in the system, of course, we really do need to deal with the length of stay issue that we have in Wales across many of our sites. I was drawn yesterday to a number of statistics which show that we've got over 1,000 beds occupied currently ahead of what we had this time last year. And many of those are patients that are delayed in their transfers of care, whether that be back to their own home or back to a care home or placement in their local community. So the focus again of this integrated system is to look at the whole pathway and ensure that we start planning for that discharge or onward care from the point of admission, and that people are informed, communicated to, and know what to expect from our system, so that when they are in a hospital setting, it is for the minimum amount of time that is required, and that they are moved through as rapidly as possible. And we know that we've got many challenges in the discharge process at the minute, whether that be with social care or community services. But the work that's ongoing in goals 5 and 6 really does support improving that particular part of the system. But also we need to focus on goals 1 and 2 so that we avoid those unnecessary social-led admissions that in effect clog up our system as we move forward. So all of the programme enablers and goals teams are now in place. We launched at the beginning of this year the national board, which I chair, which features the 6 goals leads and a number of clinical colleagues who are currently forming a clinical reference group to support the 6 goals for emergency care. But we also want to support you as health boards and our partners locally to deliver this 24/7 model right across the Welsh system. So many of you will be aware that the Minister has allocated a £25 million fund to support health boards deliver some elements of this programme, and we've got a very significant national goal action plan with some significant milestones for this year, which we are hoping to achieve, which will start to underscore the programme so we can move it forward. As part of the programme enabler, if you like, and the support that we want to give health boards, we've allocated some of the funding so that each health board can set up their own 6 goals improvement team within their current structures, recognising that everybody in the health system currently is working at 110%. I think this gives us an opportunity to establish a programme locally which is supporting the national programme, but also receive support from the national programme. We recognise also that this is a long-term goal. This is not going to be achieved overnight. And as part of that, we've then put in a number of enabling work streams to support the programme over the next few years, including things like digital and technology, a workforce work stream, and also, really importantly, I think, a communication and behaviour change work stream, which supports the way in which we try and encourage patients and the public to use our system in a different way. So as the programme starts to move forward over the next few months, I think we'll see some of the work from those groups coming out to support how we can really start to implement some of the change that we're hoping to achieve through this programme. As many of you know, we've spent hundreds of millions of pounds on emergency care over the years, much of it on a focus, if you like, on the emergency care system. The £25 million is a relatively large sum, but is dwarfed by the investment that we put into health on an annual basis. But I would also encourage health boards to look at some of the other funds that are available, which do support urgent and emergency care. The recently launched Regional Integration Fund, which is around about £140 million for Wales, is really there to support community service delivery and that integration at the front and back door. Mental Health Services Improvement Fund is an annual top slice, which again can support patients who may be presenting a crisis in the wrong way. And over the last few years, we've invested significantly in NHS 111, which is now a national service, and I think could be a key linchpin in how we change people's behaviour as we move forward. So for this year, we've focused our investment priorities on Goal 3. I think really in answer to the need to really utilise our primary care services more effectively to prevent attendance and admission at emergency departments, and also linking this with same-day emergency care, or the SDEC process. So many health boards having already introduced urgent primary care centres and are in the process of really bolstering their same-day emergency care services. And what we hope to see over the next 12 months is an expansion of both of these, so that we've got national coverage right across our health boards with these two really key investments as we move forward. Because what we can see here is a significant shift in the way in which people are presenting and also treated within the urgent and emergency care system. It will reduce handover delays. It will reduce the number of admissions and attendances within our ED departments, and ultimately deliver care closer to home. But I think more importantly, it'll be a better quality service and a safer service for patients in our urgent and emergency care system. So from a local perspective, what we're encouraging you to do is set up your local 6 goals board, which would involve developing a 6 goals programme plan. And we recognise that many of the IMTPs that we've seen so far feature the 6 goals programme. And what we are hoping to do is work with you as colleagues as you introduce your triumvirates to ensure that the milestones and objectives within your health board plans align with the national objectives. So we have a single plan for Wales and a single improvement trajectory. I'd also encourage you to engage locally with your regional partnership boards who play a key role in our urgent and emergency care system, and also ensure that your health boards and executive boards are fully informed and aware of the work that you are doing, because this will feature as part of our oversight and assurance mechanisms as we move through the year. And we've currently started our monthly, quarterly and delivery meetings, and as part of that discussion we will be discussing with health board colleagues where they are with the 6 goals programme. What we've provided for you is money to support a 6 goals improvement triumvirate, which hopefully will encourage you locally to develop clinical and professional leads, operational leads and some analytics, so that you have a clear programme as you move forward. And just finally, that the sort of reporting and review of progress. For many years we've put in place improvement plans and different policies really to try and improve our service. What I am very clear on is that this is a rigorous application of this programme. We have significant milestones to achieve and metrics to measure each of us against, and we will be using those to regularly update health boards and the National Programme Board in terms of the progress that we are hoping to achieve and hopefully will achieve during this time. As I've already mentioned, we'll use it in our updates and quarterly and monthly meetings with you as health boards, and we will be doing a half-year review of the progress against the milestones of this programme. Clearly what we will do at the end of the year is a sort of end of year report, and then set out our investment priorities as we move through into 23-24. So I hope you enjoy the rest of the day. We've got a number of breakout sessions to come after this session, and I'm going to hand back now to Glyn, who will guide us through the rest of the day, and I'll see most of you I think later on. So thank you for your time and thank you for your attendance.